Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring another in our series of interviews with top leaders in health IT. And our guest today is Dr. Kyu Rhee. He's president and CEO of the National Association of Community Health Centers. Welcome, Dr. Kyu.
Thank you so much for having me, John.
Yeah, it's great to have you here. Lots happening here at the health conference, lots to talk about. But before we dive into some of the topics you're talking about, tell us about yourself and NACHC.
So I am a primary care doc, so I was trained in internal medicine and pediatrics. And so I've had that frontline experience of taking care of patients in community health centers. And I've had a career that spanned the nonprofit sector, the public sector, and the private sector. So been grateful to have the chance to work in community health centers as a clinician, but also a chief medical officer. Also, I've had the chance to work in the federal government at NIH and the agency known as the Health Resources and Services Administration, where I was the chief medical officer there. And their goal is to serve about 90 million people across the country,
Wow.
most of whom are medically vulnerable and challenged in terms of being medically underserved. And then prior to this role at NAC, I was the chief medical officer of IBM. So in many ways had the privilege of learning a lot about technology and AI with that experience. At the time, right after Jeopardy and Watson came out. And then
That was an exciting
Yeah,
time.
that was a crazy time. It was a crazy time in 2011. Sure. And then recently, prior to this role, was the chief medical officer at CVS Health, the Aetna chief medical officer. So got a chance to see the payer world and the pharmacy world and the PBM world and all these other parts of the health system and the role we play in assuring, reducing costs, improving health outcomes. But when this opportunity came up, I'm very grateful. Community health centers are our nation's largest primary care system, and the prior CEO had been in the role for 47 years. So I was grateful that I had the chance to serve in this role, and have been in the role for about 2.5 years now.
That's awesome. So I think some people may not know exactly what community health centers are. Like, what are community health centers? What do they bring to the table? And maybe what sets them apart from other provider organizations?
So what I like people to know, what I love your audience to know, it goes back to who I am at my core, a primary care doctor. I train in internal medicine and pediatrics to care of kids and adults, families. And so at the core, health centers take care of people, families, and communities through what I call ACE, affordable, comprehensive, effective primary care. And so what is primary care? Primary care is a whole person relationship with a clinician and their team to help advance your health, to prevent disease, treat disease, to address acute situations, to address chronic care situations. And so community health centers have grown. We started, so I know you're celebrating 20 years. So we're celebrating this year 60 years.
Amazing.
So the history of our health centers, and we do call it a movement, started in 1965 with 2 community health centers. Amazing. One in rural Mississippi, that's still there, Delta Health Center, I visited, and one in East Boston, which is still there and called Harbor Health. And there were 2 doctors at that time, Dr. Jack Geiger, Dr. Count Gibson, who believed that healthcare in the US needed a new model of care. And this idea of affordable, comprehensive, effective primary care came to life. And since those first 2 health centers and those first 2 patients, we now serve 52 million people across this country in over 17,000 locations with the buying power of $57 billion in 2025. And we have a workforce of 330,000 that is delivering care to communities all across this nation.
That's so impressive. I mean, yeah, I think people have experienced a community health center, whether they realize that's what it was or not. That's really interesting. So NAC has a partnership with health. Talk about what that means for the community health center movement and how health and NAC are collaborating together.
Yeah. So there's 2 frameworks or quotes I love. So I have an older daughter, Ella, who loves theater. So we go to theater, and Hamilton has a song,
Yep.
in the room where it happens.
Uh-huh.
So I think it's important to be in rooms like health, for health centers to be in the room where it happens. And I'm grateful with the partnership with Rich Scarfo and his team to make sure community health centers are in the room. Another quote I like to use is, if you're not at the table, what are you?
Yep.
You're on the menu.
Exactly.
So the importance of being at the table of where the health ecosystem meets and, and talks about transformation like at Health US is very important as well. So I'm grateful. Rich and I have known each other since he was at the foundation of NIH.
Okay.
When I talked about previously, I was a director of innovation in NIH.
Makes sense.
And over the years, we've really recognized, the importance of these convenings that he puts together. And I'm grateful that we're in year 2, just starting year 2 of a partnership with Health to make sure community health centers are at the table and in the room where it happens.
I love that. Well, there's a lot of people in this room, right? I mean, it's a big event, so whether you're an investor here or maybe a tech innovator, healthcare leader, or even health itself, like, why is partnering with community health centers and NAC particularly important right now? And talk about the value that, they bring and, coming together brings to healthcare.
Yeah. So if you want to serve America, and we're at Health US, so it's focused on the US, you cannot not think of, or that's a double negative, you need to partner with community health centers. Why? Because we serve America. We serve those 52 million. We serve 1 in 7 across this country, including 1 in 3 in rural America. At a time when there's quite a bit of focus on rural America and the challenges they face, and a lot of the investors, tech startups, and organizations here are committing to serving all of America, health centers are the right trust broker. As I stated earlier, what is the key to having an opportunity to work with the community? Trust. How do you assure that trust? You work with community health centers who have built that trust over 60 years in over 17,000 locations with a workforce of 330,000 people that actually have patient-governed boards. So we have a trust crisis right now in our healthcare system. And when you think about it, we often talk about the importance of the patient.
Sure.
Community health centers are the only part of the health system since our founding that requires 51% of our boards to be patients who are getting care in the communities that we serve. So in my mind, if you're interested in engaging with America, community health centers are the right partner of choice. If you're interested in building trust for your solutions, we're the right partner of choice. And we're committed to partnering with you to make sure our patients and our workforce are taken care of.
That's awesome. I'd never thought about the fact that if you want the patients to trust you, partner with the right clinicians, right? I mean, we know providers, nurses are some of the most trusted people, and they're, at your community health centers. That's awesome. So, AI, emerging technologies, they're really dominating the conversation here at Health for good reason. AI is definitely happening in an interesting way. But how are NAC and community health centers positioning themselves in this rapidly evolving, faster than anything I've seen in the past 20 years, landscape?
So the way I'd like to frame this for you and your audience is a lot of healthcare fundamentally is about relationships. It is about that trust. So I, as a primary care doctor, had a patient within the context of their family. Often I saw a patient with their children, their grandparents. I was that person who took care of the whole family in the context of that community. I was not alone though. I had a whole team, a beautiful team that was representative of the needs of that patient, that family, and that community. That includes primary care. So I wanted people to stay well child visits, well adult visits, well elderly visits. I also wanted to take care of them when they were sick, whether they had diabetes, hypertension, depression, asthma, COPD. So my team is actually composed of 10 people for 1,500 patients. And so those 10 people include a primary care doctor like me. They often include a nurse practitioner, a physician assistant, an advanced practice provider. They include behavioral health specialists, which often includes psychologists, psychiatrists, family and marriage therapists, and social workers like my wife. They also include oral health, like dental hygienists, dentists. They also include often pharmacists, pharmacy technicians, pharmacists. Nutritionists, dietitians are also part of the team. Optometrists, ophthalmologists for vision health. We were just talking about the importance of vision, right? The vision.
I have that problem.
Yeah. We need to work. I told you could go to a community health center. There's probably 20 within 5 miles of here.
Which is awesome.
Yeah, which is awesome. And there are also community health workers and enrollment specialists. With HR1, we're going to have to make sure people stay on their Medicaid, on their SNAP, on their other programs. So the beauty of health centers is we have relationships with the team, but how does AI fit there? AI fits because it should support not only the patient and the family, it should support that team, that primary care team. So we have a framework at NAC and for our community health center movement. We want to be the employer, provider, and partner of choice. And so when I reflect on the AI companies and investors, please ask yourself, how is my technology helping the workforce, especially in primary care? The 330,000 people that health centers are the trust brokers for the 1 in 7 we serve. So if you think about it, Annie Harris Poll, as you referenced, will typically make the nurse, the doctor, the most trusted entity in the healthcare system. So how is it supporting the employer of choice? How it's supporting the provider of choice? I'm not going to use a solution if it doesn't improve health outcomes or reduce my costs. So that's going to be a key part of being a provider of choice. How is that technology or that solution helping me be a better provider, supporting me and my team? And the last one is, I will tell you, there is, as I experienced at IBM, when Watson started, when AI was kind of no more AI winters. If you like Game of Thrones, I say now there's no more AI winters, right? Winter is not coming anymore with AI. But we need tech companies and healthcare companies like here at Health to come together more, to seek to understand each other, get short-term wins, and really bridge the opportunities to assure that you're delivering the employer of choice for the workforce and the provider of choice for the patients. So we're excited about that opportunity here at Health and for the next 60 years as we celebrate 60 years.
Let's dive into that a little more. Like, Health is known as kind of being this incubator for groundbreaking and ideas and innovation and things that are happening in the industry. What would you say are some of the boldest or most innovative initiatives that NAC and community health centers in general are implementing to transform care delivery? I had a panel this morning. They're like, we need to transform care, not just put Band-Aids on some problem that is still the problem.
Mm-hmm.
What are some of those initiatives that you're working on that are innovating?
So I'll go back to the framework I talked about, employer, provider, and partner of choice. So in many ways, the initiatives we're working on fit into those three categories. Okay. But I also want to talk about the history of community health centers. For 60 years, actually, for example, I'll give you the start of community health centers started with food as medicine. Dr. Jack Geiger and Dr. Count Gibson started in rural Mississippi thinking about how they needed to go beyond the exam room to help serve those in rural Mississippi who were malnourished. So Jack Geiger gave food prescriptions. They started a farm co-op.
60 years ago.
60 years ago. And so the key point here is to realize that we are in our DNA naturally innovative, we're naturally resilient, because we look at the communities that we serve with our patient-governed boards, and we say, what does that community need? Now, 60 years later, with all the tech innovation that we were talking about, and the opportunity to leverage a high trust network of 52 million patients served by 330,000 clinicians and staff, there's a huge opportunity to bridge the technology into these solutions all across this country for 1 in 7 and 1 in 3. So this is going to be a challenge, I'd say. I think trust is not always easy in our industry right now, but I do think we can be that trust broker for those communities all across this nation.
Let's dive into some of that, right? There are barriers and challenges that every community health center faces. What would you say are some of those barriers or challenges to adopting new technologies, and how is NAC working to kind of help them and address the issues?
Yeah, so funding is usually a challenge, I would suggest, and it's so important. If you're building a solution, you want to align mission and margin. And so right now, community health centers are experiencing, I'd say, hope and concern. So let's focus on the concern. The patients we serve for 52 million people, and the fact that at a community health center, we have to see everyone regardless of ability to pay.
Sure.
So I have to see anyone. My 2,000 patients, 20% of them were uninsured. I didn't get paid for those uninsured patients.
Sure.
So there is a lot of concern about funding. There's concerns about HR1. We anticipate HR1 will lead to 4 million more uninsured patients coming to community health centers, which will impact us at $7.3 billion a year. If you recall, I was saying this year, $57 billion to serve 1 in 7 people across the country.
Amazing.
So a loss of revenue of $7.3 billion is very significant. It will lead potentially, if the Congressional Budget Office is right, to 1,800 sites being closed. It will lead to 34,000 jobs being lost, the economic impact that we deliver. But so this is the area of concern that we have in this moment, with obviously very few things in Washington people agree on. But I'd say one thing over our 6-year history that's been very powerful is we are nonpartisan and gotten bipartisan support. We are integrated into making America healthy again. If you look at the MAHA caucuses, both in the Senate and the House, we have bipartisan support. And right at the top of those lists say primary care and supporting community health centers. That's where I have hope. I also have hope because I know companies and organizations like that are here at Health know and understand that in order to reach to America, they need to work with community health centers. And we've been very effective at a local level, at a state level, to partner with partners in the public and the private sector. And I believe the opportunity to no longer be the best kept secret in our health system. In 60 years, most people, as we're discovering in health, were not aware of us as the largest primary care system in the nation with a buying power of $57 billion. I'm a big believer we're going to have opportunities to be partners of choice at a national level with many organizations that are here now and tomorrow.
Well, in many ways, community health centers are that gem of healthcare. Mm-hmm. It's really amazing work. As you look forward, what's your vision for the future of community health centers over the next 3 to 5 years?
Yeah. So in the next 3 to 5 years, and I'd love to expand it just to 20 years, because I think vision is important to think short-term and long-term.
Yeah, that's fair.
But look, 25 years ago, I had the privilege of working in health centers and doing the challenging work of seeing patients one person at a time and having that panel of 2,000 patients and taking care of families. And I am rooted in that mindset for everything that I do as the president and CEO of NAC and the opportunities we have for partners of choice across the health system. So I believe at that time, we were serving only 1/3 of the patients we're serving today.
Wow.
In 25 years, we tripled in size. So if you're a business that wants to grow, we've been growing and tripled in the last 20 to 25 years.
Shows the need too.
It shows the need and it shows the support in the public sector and the private sector for the value that we deliver. In the next 20 years, I believe we will triple because affordable, comprehensive, effective primary care, there is no better solution than community health centers. And so by 2045, the goal is to serve 1 in 2 people in this country through community health centers, and likely almost all of rural America by that time, because we serve 1 in 3 today, so tripling would mean, and unfortunately, rural America is having a tough time right now.
It is.
And the only typical game in town for hundreds of miles is community health centers. Now, going back to the next 3 to 5 years, if we're talking about 2030, I believe we can and should be a strong component of partnerships with the public sector. So making America healthy, as I've met with Secretary Kennedy and Dr. Oz, they both articulated, we can't make America healthy again without community health centers. And the bipartisan support that we have in Congress and with members of the administration is going to be essential for that in the public sector. But as I look to the private sector and places like Health US, I'm excited about the interest that so many folks have in the private sector to partnering with us to help us achieve that goal of really serving 1 in 2 and across this country in 20 years, but in the next 3 to 5 years, partnering with us to explore opportunities to work with health centers so that they can help us be the employer, provider, and partner of choice.
That's amazing. Dr. Kyu, I love your passion. I love the work that your community does to take care of patients. It's such an important part of our healthcare system. So I appreciate you taking time to sit down with us and share kind of your insights and perspectives, help people understand how they can partner with other community health centers and with NAC in general. So
yeah, thank you so
coming.
much, Sean. And I really appreciate you taking time to talk to us and sharing with your audience what we're about. And grateful for a year ago, we had a shorter interview. This is a longer one. So grateful. And I'd ask people in your audience to just look up NAC.org, NACHC.org, and also find a health center. There, if you Google that, you'll go to a website where within 5 miles, 10 miles, 20 miles, you'll see your local health centers. Please reach out to them and realize that they are employers, providers, and partners of choice. Thank you, John.
Awesome.
Thank you.
Thanks, Dr. Q. Thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcast applications. Thanks, Dr. Q.
Thank you. Thanks so much.